Hi everyone, Namaste. I'm Dr. Avinash Kulkarni, consultant neurologist, Gleneagles BGS Hospital, Bengaluru. So by now, all of us are aware regarding the vertigo, that is the giddiness sensation. That's one of the very common symptoms that patients come with to neurology OPDs. So you must be wondering what happens to me when I get a vertigo, when I go see a neurologist or go see a doctor. What is the procedure? What happens there? So I just want to briefly decode what happens. Like whenever somebody comes to us with a vertigo, the most important thing always in the diagnosis of vertigo is the clinical history. So what we would make sure is that go through the each detail of how the symptoms have started, during what scenario the symptoms are precipitated, like whether it is position related, non-position related, is it during the walking. So many symptoms, so many intricate history details are necessary in order for us to really understand. So after a detailed history, we'll make a brief clinical examination, or rather I would say a focused examination, where we would pick up certain signs or certain findings which are there if somebody is suffering from particular type of or particular reason for the vertigo. So after a brief history and clinical examination, majority of the cases, I would say at least 50-60% of the cases would be able to manage without additional testing, because that gives us enough information to deal with. But in further subset of the patient, that is the baki 40-50% only. So in order to get additional information, what we will do, we need help of the certain test. So I'm very happy to tell you that we have a dedicated vertigo clinic here, and we have a dedicated vertigo lab, wherein there is we have a test called something video Nystagmography, that is VNG. So this is one of the precise tests that is used these days very commonly to understand which is the particular reason or from where the vertigo is coming from. So just to make you understand a little more better, so vertigo can come from, grossly if you have to classify, it will come from two places. One is inside the brain, other is outside the brain. So vertigo, if it comes from outside the brain, it's called peripheral, that means away from the brain. If it comes from the brain, it's called central vertigo. So this is the primary most information that we need while dealing with vertigo. So the VNG has a very important role in letting us understand whether it is from the central or it's peripheral. So few people will need VNG, and we have a very dedicated team, vertigo lab, where we routinely conduct these tests. So VNG test may be necessary. And few of the patients, if they have associated hearing loss or some tinnitus, ringing sensation, we may take help of our ENT colleagues to evaluate for the hearing related issues. And in some people where we raise a suspicion that it could be central, of course, there is a need for an MRI brain as well as a blood vessel testing, all those things. But rather I would say majority of the patients, like if we see 100 patients of coming with a vertigo, majority of them would be having non-serious causes. So the moment you get vertigo, no need to be panicked. Just reach out to us so that we can detailedly go through your clinical history, examination, and necessary tests whenever is needed, and then decide on what needs to be done. So most of the vertigo are easily treatable, and we can make sure that the quality of life improves significantly. Thank you.